Hi, David with wheelitforwardusa.org. Today we're talking about wheelchairs, standard wheelchairs to be specific in this case. Wheelchairs are for individuals self-propelling is what we're talking about. One of the key factors is having the right equipment for the right person. Having the person's height and weight on almost every equipment request is very important. And also making sure that we have the right equipment based on those measurements. To know what chair may or may not be correct, a lot of times people are going to come in and ask for an 18-inch or a 20-inch wide wheelchair. The best way to know that you're giving them the correct information would be to just take a quick measurement. And the best way to do that on a wheelchair is to measure the upholstery on the seat. Measuring the upholstery on the seat from outer edge to outer edge will definitely tell you what the measurements of the chair are. In this particular case, this wheelchair is 18 inches. It's from the outer edge of the seat upholstery to the outer edge of the seat upholstery. Most standard chairs are 16 inches deep. That's important in case the person is recommended to get a seat cushion as well. You want to have the right seat cushion for the right wheelchair. So there are people that need a little more support. There are wheelchairs that also allow for an adjustability of 18 inches deep on this chair. And again, 18 inches on the standard wheelchair itself. One of the other accessories that comes with this wheelchair, with all wheelchairs, is the ability of having anti-tippers. If somebody is having their brakes locked but becomes fidgety and wants to try and move themselves while the brakes are in a locked position, the chair has a risk of tipping. So you would also want to double check whether the medical professional recommends anti-tippers. Anti-tippers come in different styles for different chairs, so having an understanding of that device and its need should be noted. This is a standard full-length armrest wheelchair for self-propelling. The armrests themselves extend all the way out to the frame of the chair. They do also come with an option of desk arms. Desk arms are shorter than a full-length armrest. This particular type of armrest allows you to get closer to a table or a desk, allows the ability to reach objects on that desk or table a little bit better, having the opportunity to bring the chair closer to that item. Different chairs also can come with the footrests on this chair are standard swing-away footrests. They have two pins that sit on the frame. They line up with the two holes that are on the leg rest itself. When properly in place, they snap in place. This lever, you want to make sure latches on properly. The adjustment height for the leg rests are usually on the mast section. When you are properly adjusting the height of the pad, you want to make sure that the thigh remains parallel to the ground. Having the knee come up too high brings the knee up underneath your chin per se, and that can put strain on your lower back. It should also be noted that PT or OT properly adjusts these for you, just to make sure that you are comfortable in the chair itself. There's also something called elevating leg rests. The elevating leg rests allow for an individual to raise their foot to help with edema and other swelling issues as they relate to a medical condition. This is something that is normally recommended by PT, OT, or your medical professional to ensure that this is the right piece of equipment to help you in your needs. The lever can be pushed forward, the leg rest drops to have it in its normal resting position. The elevating leg rests do come with a calf pad to help the legs stay supported when the leg rest is elevated. The leg rest length to help in the positioning of the knee and the thigh can be adjusted on the leg rest itself. It has an anti-rattle latch. You can depress the buttons on the mast section of the leg rest and either extend them out further so that the knee is not as high, or pull them in closer so that somebody with a shorter leg is not having extra weight bearing on their thigh when they're properly seated in the chair. This particular chair is similar to a standard wheelchair, but it has a much higher back for support for someone lacking trunk strength. This is also a device that should be recommended by a medical professional for its specialized purpose. The chair itself allows for someone to release the pistons so that the chair can be reclined back in this position, and then also brought back forward into its regular seating position. There's a spreader bar that's on this particular chair. When there is weight in this chair, this bar must be properly secured between these two anchor points. When not in use or needing to be transported in a vehicle or stored for short-term needs, this chair does allow you to lower this suspension bar, pull the seat up, allowing it to be narrow enough to place into a vehicle or into a storage area like a closet when not in use. Pushing down on the seat upholstery will allow you to put the chair back into its regular seating position. Some have guides at the base. You want to make sure that that seat is properly in those guides. And then you want to properly insert the spreading bar back into the back position of the chair, tightening the knuckles so that it remains in place. Without doing this, when an individual's in the chair, it can cause the chair to fold in, causing rounding of the shoulders, which would cause discomfort for long-term seating. This chair does come with an extension for the headrest support, and that support's very important, especially if someone is taller and is going to be in a reclining position, oftentimes for short-term napping during the day. This reduces the need to transfer a patient in and out of bed or into another seating environment. Some come with a neck support. Others might use a device that you might see on an airline flight that drapes around the neck. Either way, most chairs do come with them, and you would want to make sure that that's the proper piece of add-on equipment per the medical professional. Tilt and space chair is something that requires an extra person, caregiver, to be involved when properly adjusting the back of the chair. That medical professional caregiver squeezes the levers, which allows the pistons to release and adjust to the proper setting for the reclined position. Let go of the release of the levers and it will lock in place. At that point, the patient is safe to be on their own in the chair, but should they need to be positioned in order to sit up again, the caregiver does need to come around to the back, squeeze the release levers, adjust to the proper seating position, release the levers, which then engages the pistons. As a reminder, volunteers, when you are giving out equipment, you want to make sure the function of all aspects of the wheelchairs are properly working. So you do want to make sure that the brakes, when engaged, make sure the wheels don't shift or move. If they do, then you want to take that chair temporarily out of service until a technician's able to adjust the brakes so that they hold tight. That's very important when somebody is transitioning in and out of the chair. It's weight bearing at that point. Person sits down. You want to make sure that the chair doesn't shift at all. Full length arms make it easier for somebody to stand nose over your toes and allows you to safely stand from that position. Brakes in place.